my name is Elizabeth Rosas, and I will be discussing my client's case. So my client is an 80-year-old Caucasian male. He served in the Army, so he is a veteran. And so he is under our veteran-assisted living program. He is under our transitional housing program at the moment. He has been there for a couple of years, and so we are trying to move him to permanent housing, but he is a special case because he is elderly. He also reported that he is on hospice. So he reported that he has a caseworker there. So I'm working with his caseworker to finalize any treatment after if he dies in our program in our apartment complex. And so working with him, as well, providing the client with care and like comfort. The client has reported that he has high cholesterol, high blood pressure, and he reported having prostate cancer a while ago. He did not remember that, as well as he takes medications for those medical conditions. His mental health is well. He did not report any psychological limitations or any past like depression, PTSD, any of that. So he is good to go in that area. He reported that he uses a walker to get around. He does have an oxygen tank he has in his room, but he does not need it when he walks around. The client reported socially that his family, he has two sons that he speaks to. They live out of state. One is 43 years old and one is 50 years old. And so he speaks to them. And the client financially is stable and is capable of taking care of his needs. He gets income from SSI. And so moving forward, he is on my caseload, and so I just check on him weekly, as well as in the process of finding permanent housing for him, and speaking to his sons, to see what kind of level of care that they're interested in having their dad be in, because this is not the type of environment for this client to be in, especially in hospice. So I want to provide that level of care where he has comfort and he has space, and as well as providing, asking his sons about what they potentially would like to see as well. There was no history of neglect or abuse, and the client reported that he's well, he's happy, he's very, has good energy for being elderly, and remembers a lot. So he did discuss a lot about his time in the service and where he used to work, and his sons and all of that. So moving forward, the client, we are just working on finding him permanent housing at the moment, and he is well. And he does have a nurse that he sees as well, that sees him once a week. Thank you.